Hello everyone! Welcome back to MJ Pharma. Today, we are covering the drug of choice for common CNS disorders, from epilepsy to Parkinson's, depression to meningitis. We will go through the first-line treatments used in neurology and psychiatry. Let's begin the journey through the brain and beyond. Drug of choice for generalized absence seizure: ethosuximide and sodium valproate. Drug of choice for absence, petit mal, seizures: valproate. Drug of choice for absence seizures in children: ethosuximide. Drug of choice for myoclonic seizures in men: sodium valproate. Drug of choice for myoclonic seizures in women: lamotrigine. Drug of choice for focal seizure: lamotrigine. Drug of choice for generalized tonic-clonic seizures, GTCS: lamotrigine. Drug of choice for tonic-clonic seizures: sodium valproate. Drug of choice for infantile seizures: ACTH. Drug of choice for rhinorrhea: citrazine. Drug of choice for phobias: selective serotonin reuptake inhibitors, SSRIs. Drug of choice for reducing pre-anesthetic anxiety: lorazepam. Drug of choice for status epilepticus: idovilorazepam. Drug of choice for febrile seizures: diazepam. Drug of choice for partial seizures: carbamazepine. Drug of choice for attention deficit hyperactivity disorder: methylphenidate. Drug of choice for Alzheimer's disease: rivastigmine. Drug of choice for obsessive compulsive disorder, OCD: fluoxetine. Drug of choice for drug-induced Parkinsonism: benzhexol. Drug of choice for Parkinsonism: ropinirole, pramipexole. Drug of choice for glioma: nitrosourea. Drug which has pain relief properties without opioid disadvantages: tramadol. Drug of choice for sedation in patients with severe liver failure: lorazepam. Drug of choice for maintenance treatment of generalized anxiety disorder: buspirone. Drug of choice for cerebral edema: mannitol. Drug of choice for increased intracranial pressure: mannitol. Drug of choice for psychomotor seizures: carbamazepine. Drug of choice for mania: lithium carbonate. Drug of choice for Huntington chorea: tetrabenazine. Drug of choice for Parkinsonism: ropinirole and pramipexole. Drug of choice for morning sickness: hyoscine. Drug of choice for multiple sclerosis: amitriptyline. Drug of choice for acute attack of migraine: sumatriptan or ergotamine. Drug of choice for night terrors: benzodiazepines. Drug of choice for atypical depression: MAOS inhibitors. Drug of choice for hydrocephalus: glycerol or acetazolamide. Drug of choice for cluster headache: sumatriptan. Treatment of choice for cluster headache: high-flow oxygen. Drug of choice for infantile spasm: ACTH. Drug of choice for Huntington chorea: tetrabenazine. Drug of choice for multiple sclerosis: interferon B. Drug of choice for pulmonary edema: morphine. Drug of choice generalized anxiety disorders: diazepam, benzodiazepines. Drug of choice for pain and terminal illness: morphine. Drug of choice for pain of acute myocardial infarction: morphine. Drug of choice for chronic cancer pain: morphine. Drug of choice for borderline personality disorder: buspirone, 5-HT partial agonist. Drug of choice for neonate with respiratory depression due to use of morphine to control severe labor pain: naloxone. Drug of choice for sedation in liver failure patients: lorazepam. Drug of choice for decreasing anxiety in children preoperatively: antihistaminics. Drug of choice for sedation in patients with porphyrias: benzodiazepines. Drug of choice for trigeminal neuralgia: carbamazepine. Drug of choice for status absence: benzodiazepines. Drug of choice for convulsion and lidocaine-treated patients. Diazepam. Drug of choice for tardive dyskinesia. Diazepam. Drug of choice for convulsion and tetanus patients. Diazepam. Drug of choice for delirium caused by ketamine. Diazepam. Drug of choice for febrile seizures. Diazepam. Drug of choice for endoscopic and colonoscopy. Midazolam. Drug of choice for hypnosis in elderly. Zolpidem. Drug of choice for diabetic neuropathy. Topiramate. Drug of choice for neuropathic pain. Lamotrigine or topiramate or gabapentin. Drug of choice for reducing alcohol craving. Naltrexone. Drug for decreasing relapse of alcoholism. Acamprosate, NMDA receptor antagonist, or naltrexone. Drug of choice for alcohol detoxification. Disulfiram. Drug of choice for smoking cessation. Bupropion. Drug of choice for depression and Parkinson disease. SSRIs like fluoxetine. Drug of choice for Parkinson disease. Levodopa. Drug of choice for psychosis and Parkinson disease. Clozapine. Drug of choice for depression. SSRIs like fluoxetine. Drug of choice for restless leg syndrome. Ropinirole. Drug of choice for violent behavior. Haloperidol. Drug of choice for psychotic depression. Loxapine. Drug of choice for neutropenia and Felty syndrome. Lithium. Drug of choice for patients with extrapyramidal symptoms, EPS. Clozapine. Drug of choice for negative symptoms. Clozapine. Drug of choice for treatment-resistant schizophrenia. Clozapine. Drug of choice for elderly with schizophrenia. Clozapine. Drug of choice for peripheral neuropathy. Lamotrigine. Drug of choice for bulimia. SSRIs like fluoxetine. Drug of choice for acute mania. Lithium. Drug of choice for serotonin syndrome. Cyproheptadine. Drug of choice for nocturnal enuresis. Desmopressin. Drug of choice for major depression. SSRIs like fluoxetine. Drug of choice for heat stroke. Chlorpromazine. Drug of choice for obsessive compulsive disorder, OCD. SSRIs or clomipramine. Drug of choice for sleepwalking. Carbamazepine. Drug of choice for cluster headache. Lithium. Drug of choice for cyclical vomiting. Lithium. Drug of choice for bipolar mood disorder. Lithium. Drug of choice for reducing hyperexcitement in acute mania. Haloperidol. Drug of choice for reducing excitement in chorea. Haloperidol. Drug of choice for reducing hyperexcitement in acute schizophrenia. Haloperidol. Drug of choice for reducing excitement in delirium. Haloperidol. Drug of choice for post-traumatic stress disorder. SSRIs like fluoxetine. Drug of choice for somatic pain. NSAIDs. Drug of choice for bipolar depression. Lithium. Drug of choice for depression with hypotension. SSRIs like fluoxetine. Drug of choice for depression with heart disease. SSRIs like fluoxetine. Drug of choice for depression with insomnia. Amitriptyline. Drug of choice for pain in aspirin allergic patients. Paracetamol. This video is for educational purposes only. Always consult a qualified medical professional before prescribing or taking any medication. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.